Okay, it is Tuesday at roughly 5:30. I'm a little late. Apologies. So hope everyone's having a good week and everything's off to a good start. Let's see. We've got a couple questions on the feed here. What age do you recommend starting to treat? What age do you recommend to start preventative Botox? So preventative Botox refers to the idea that with judicious regular use of Botox, it not only treats the wrinkles that you can see, but it actually slows the clock down. Talk about a lot of treatments as either being something that turns the clock back or something that slows it down, or ideally both. Botox or Dysport, both, we call them neuromodulators. Any neuromodulator, whether it's Botox or Dysport, can potentially slow down the clock. And, the presumed mechanism is that the way the neuromodulator works is it temporarily weakens the muscles in the area that are treated. So you have your 11s or your frown lines here, you've got your crow's feet, you've got your forehead lines. Those are formed by muscles, and just like every other muscle on the body, if you work out your bicep a lot, it gets really big. If you don't work out your bicep at all, it gets really small. Same thing with the muscles in the face. Presumably, if you inject a neuromodulator such as Dysport or Botox regularly, the muscles will get smaller over time, and so the lines fade. But the presumed secondary effect is that if they're less strong and smaller, they're going to have less of an impact on the skin over time. And so the ability to etch in and deepen those lines is going to be decreased. And I think that makes a lot of sense. And experientially, I've seen that as well. And so as far as what age do you start, it's going to be different for every individual because people age at different rates. What I tell people is that, once lines are etched into the skin, they're basically there forever. There's no way to truly get rid of a line. If it's really fine, good skincare, some chemical peel, some aggressive resurfacing, you can erase some very fine lines. But for all intents and purposes, once a line is etched into the skin, it's pretty much there. And then we're talking more about reducing the appearance and then slowing it down from getting worse. And so using that concept, you can say to yourself, okay, well, I don't want those lines to get etched in the first place, in which case you should really start quite early, mid-20s, late 20s, something like that. And if it really is just preventative, meaning you don't have lines we're actually trying to treat, then you can get away with a lower dose. I usually start with a 50% dose, so it's half the amount of product, half the cost. And that's enough to kind of weaken things and slow things down. And that way it doesn't break the budget as well. But I think a mid-20s is a reasonable, if you really want to be aggressive and really try and prevent things, I think mid-20s is a good place to start. So otherwise, it just comes down to your personal priorities and kind of what your stage of facial aging is from that standpoint. So, all right. And then next up, we've got, do you do the ab etching with tummy tucks? So the ab etching, a lot of people call it 4D Vaser, 4D liposuction. The concept there is that you're going to strategically over-treat, so to speak, specific areas to try and surgically created depressions in the skin to give the impression of, for example, a six-pack. So the way this works, so standard liposuction, the way you do that is your goal is really to create a very even layer of tissue behind. And so people have, a lower abdominal pooch where there's just some stubborn fat in the lower belly. And so you liposuction that to try and smooth it out. You're trying to suck out the excess so that you're left behind with a nice even layer of tissue so that it just looks like a nice even flat stomach. If you do liposuction poorly and you just stay in one area really aggressively, you'll get a contour abnormality, something they would call a bad outcome, where you get a line or a depression or something that just doesn't look right. Or if you're too aggressive in a thin patient, you can get kind of irregularity in the skin where it kind of ripples and looks irregular. It doesn't look good. It's definitely a bad outcome, and it's something to be avoided. And you can get kind of a very unnatural appearance. It's not like you look skinny. It's you look skinny, but it looks really weird because it just doesn't look right. However, plastic surgeons, being the clever people that they are, said, wait, maybe we can use this to our advantage. Maybe this is another arrow in the quiver, another tool we can use. And so by strategically, aggressively liposuctioning in this kind of pattern of a six-pack or whatever it is you want to etch into the skin, you create those depressions in a very strategic way to create the impression of a six-pack in somebody. I don't personally do that operation. Maybe there's people out there who sing its praises, love it, they get good results, and not going to knock them, not going to say anything about them. The reason why I don't do it in my practice is my concern is related to the long-term results for those patients. My concern is that we do this operation, I take a picture at 3 months or 6 months and it looks really, really good. I put that on my website. People look at it on my website, on social media, and they go, oh my God, that's amazing. Correa is amazing. What they don't see, and what my concern is, I take a photograph of that same patient 2 years later, 3 years later, 5 years later, 10 years later, and all of a sudden that perfectly etched six-pack muscle that used to be up here in the right spot, and you're looking like, Leonidas from 300. All of a sudden that skin, well, it ages just like every other skin on the body. And guess what? Those etched lines, they're going to start to drop. They're going to start to form weird angles. Maybe you'll gain weight and it's going to look very bulgy and weird. Maybe you lose weight, skin loses elasticity, now it starts to hang. Now you've got six-pack pockets of fat that are now loose skin hanging over that scar tissue where those things were etched in. And you say, hey, Correa, man, I looked amazing at 6 months. I looked amazing at 2 years, but guess what? I'm 40 years old now. I'm not 30 anymore. Oh, hey, I'm 45. I'm not 35 anymore. Hey, it doesn't look that great anymore. Can you fix this? Really, really, really hard to try and fix that. And so that's my concern. Again, maybe there are surgeons out there that are really amazing at that. Maybe they've got 5-year, 10-year follow-ups that still look amazing. Maybe they've got 5-year, 10-year follow-ups that their result have been compromised and they've gone in and revised it, no problem, and been able to fix it. My concern is that that might be challenging. So anyway, a very long and padded way of saying that I don't particularly do that operation and don't generally recommend it to my patients. If there are surgeons out there that can do an amazing job and convince you that they do that and their long-term results are fantastic or fixable, my hat's off to them and congratulations to them. And hopefully you find your way to the right folks. So let's see, what else do we have on here? Okay, a couple from last time that I didn't quite get to. Difference between a mini tummy tuck and a full tummy tuck. I feel like we got to that. We'll touch on it again in case I think I got to that last time. Let's skip that, and then if we have time at the end, I'll kind of touch on that again because I feel like we discussed that last time. And then also that we didn't get to last time, men getting injectables. What are the common areas for men for male facial rejuvenation? The male population is kind of a growing population in the cosmetic world. Historically, the population of cosmetic patients has been predominantly female. It still is, but the percentage of men getting involved is definitely growing. Botox, kudos to them for just an amazing marketing team, but they of course branded the Brotox concept, which is just brilliant. But the point is that the products still work in men. The challenge in men, or the thing you have to be sensitive to and judicious with, is you don't want to feminize men. And so males in general have coarser features and stronger features. And in a man, that often looks good. We think of it as being rugged. We think of it as being masculine. We think of it as being tough. We think of it as being macho. And so, think of somebody like Clint Eastwood, in an old school Western movie, or someone like that, where they have very coarse features, but that frown, that scowl is it makes them attractive, it makes them masculine, it adds to their expressivity. And so you have to respect that and you have to be sensitive to that. That being said, there are different looks and different goals. And so men coming in for cosmetic surgery, some of their most common complaints, it's not that they don't necessarily want to look younger, they're not trying to look pretty. Oftentimes what they complain of is they look tired. People think they're angry when they're not. people think they get puppy dog eyes or puppy dog eye looks and things like that. And so it's more about trying to prevent these kind of unwanted comments or perceptions that they don't feel are representative. And so the goal is really to make them look a little bit kind of more refreshed or rested, so to speak, while still respecting that kind of more rugged and coarse features that men generally have compared to females. And so you can get very good results with Botox and Dysport with neuromodulators. You can get very good results of that without feminizing a male patient. Same areas, crow's feet, 11s or glabella, forehead lines, things like that. In men, you do have to be more careful with the eyebrow. Men don't tolerate, the chemical brow lift in a man is not a good look, generally speaking. So you have to be careful with that. But still common areas to treat in terms of the forehead. I treat my crow's feet, I treat my forehead, I treat my glabella, and I don't have weird appearing eyebrows or a feminized appearance, in my opinion. And then from a filler standpoint, it's going to depend on the areas that people are really concerned of. In my practice, most common areas I inject in a man are typically the nasolabial folds. Men can get a very heavy midface where you start seeing that line form there. And a lot of men don't like that once it crosses a certain threshold, or they'll see a photograph of themselves, 10 years prior at a party or something like that. And they're like, wow, I didn't used to have that deep line there. And then you start getting, Steven Tyler and Aerosmith singing in your head about the lines on my face keep getting deeper. And so you can start wanting to dial that clock back. But nasolabial fold is definitely a good go-to option. Cheeks are a good area to treat in men, but it is an area where you have to be very careful, where if you overdo it or inject poorly, very easy to feminize a man, give him softer features that I don't think looks good. But you can do that area. Jawline, also another one that's pretty good in a man. Help strengthen up the jawline, help hide jowling, things like that. Chin also, men and women, but men and women both. Chin, nose, also common areas to fill, either to strengthen a chin, meaning a man already has a normal position chin but wants kind of a stronger appearance, or a patient has a weak chin and you're trying to just get it back to normal, so to speak. And then nose, if people have a bump on the bridge of their nose, filler, a very good option for smoothing that out, kind of camouflaging that result. So all very common areas that get treated. But again, very case by case, and need to be extremely sensitive with respect to preserving masculine features, not overly feminizing, to get a nice result. So let's see, where are we at? So I've lost track of time because I was late, so I have no idea what the 15-minute mark is. So if I go over, I apologize. Let's go ahead and touch on mini tummy tuck and full tummy tuck. The short version is basically a mini tummy tuck treats a little bit of lower abdominal extra skin. This is for patients where their upper abdomen basically looks perfect. They don't have a ton of extra skin. They just have a tiny little pooch below the belly button, and it's just a small amount of skin. So a true mini tummy tuck is a very minor operation. Short scar just below, between the hip bones and very low in the underwear line or towards a C-section scar. And just treats some of that lower skin area. Usually those patients are very thin to begin with. They're generally very thin and fit. They just have some stubborn skin that exercise will unfortunately never do anything for. There's no plication, there's no internal corset, and it's just a very miniature approach. And it's not the number of patients who that's the perfect operation for them, pretty small. Most patients benefit from plication on the internal corset. Most patients benefit from something to treat the belly button. Most people benefit from a little bit of liposuction. Total pie chart of tummy tucks, it's definitely a smaller percentage, but in the right patient, it makes a ton of sense. It's a great operation, easy recovery. Full tummy tuck, basically slightly longer incision, requires an incision around the belly button, and a full tummy tuck is for somebody who has upper abdominal issues in addition to lower abdominal issues, and also somebody who has a lot of rectus diastasis or weakening of the abdominal wall from either babies or weight gain or loss, things like that. And so the full tummy tuck allows you to treat the upper abdomen, the lower abdomen. You get rid of more skin, you tighten internally, but that's also a bigger operation, bigger recovery. more restrictions post-operatively and things like that. So, I mean, ultimately, people are always attracted to the word mini. Anything that sounds like less sounds like more, and anything that sounds like less sounds like easier, and anything that sounds like less sounds like, oh, maybe I can do that instead of doing the full one. And it's kind of a backwards way of thinking about it. It's more identifying where you're at, where we want to be, and how do we get there. Sometimes it's a mini tummy tuck, sometimes it's an extended mini tummy tuck, sometimes it's a full tummy tuck, sometimes it's an extended full tummy tuck. So there's a whole spectrum of operations. And I mean, frankly, that's why we go to training for so long. That's why everyone wants to know how much experience you have. That's why people want to know how long you've been in practice and how many operations you do, because it's our judgment determining where you're at and how we get to where we want to be that determines the operation. And so, doing internet research and Googling around can be challenging for that reason, because people see a nice result and think, oh, I need what she had. And it's like, well, unless you're exactly the same as that patient with the exact same goals, the exact same pre-op anatomy, that operation may not exactly be the right thing. So, okie doke. Well, I think we've covered some good bases today. Apologies for being late. Hope everyone's week is off to a good start. Can never complain about being busy, so that's a good thing. Look forward to seeing you guys next week, and spread the word. Over and out.